slide is that I am here tonight in a professional capacity, but I'd like to share that I'm also a person who's a family member of somebody who has struggled for many years with depression. I've been a primary support to them and have really kind of gone through it in terms of navigating treatment across the spectrum. And so I always like to carry that lens with me because I don't know, sometimes I think as providers, when we talk about accessing care, we make it sound easy, and it's far from easy. I know that, I'm sure many of you know that it's complex, and I appreciate even with my knowledge and training and the resources that are at my disposal, how difficult it can be. So I just like to share that with you all. Before I delve into the content that I'll be just addressing, I want to preface this with sharing or an acknowledgement that in my experience, there are two kind of great flaws within our mental health delivery system. The first is that the system tends to locate problems within the individual. We decontextualize people's problems. We heard from Dr. Wang that we're seeing shifts in that, thinking about social determinants of health and looking at the things that people struggle with external to them that may be impacting and weighing on them and impacting their mental health. We're doing better with that. But historically, we've really looked to individuals to say, this is your problem. And what that does is it puts the responsibility then on them to fix it, right? And that's a big thing to carry as well, especially when it's a mix between what's happening internally and then what's kind of compounding that or contributing to that externally. And even though the system is individualizing the problem, we don't tailor treatment to the individual. So that's really important. The treatments that we have can be wonderful, but they're not one size fits all. And so part of this complex system is really, how do we navigate all of this to find what is right for that individual, for your loved one? So the next few slides, I'm going to look more broadly at different treatment options, or what we call levels of care. You can see here on the screen before you that levels of care really look at or discuss intensities of efforts required to either diagnose, treat, preserve, or maintain an individual's mental health status. When I talk about levels of care, I'm going to do so in a somewhat linear fashion, but people don't tend to access them in this order. It would be ideal if we could, that people would move from level of care to level of care depending on their needs, but often the lack of availability or being able to access at the right time makes that really impossible. So it's a significant barrier that people encounter. All of these levels of care that we'll talk about would be appropriate to address depression and other mood-related disorders, depending on what the person is experiencing, what their symptoms are, their particular diagnosis. As I discuss each one, I will try to present a general picture of, when the level of care most likely would be utilized, when you might consider looking at another level of care. I also want people to be aware that for more information that I'm talking about, you can always consider calling like a 211 line to learn about services that are available kind of locally to you. Insurance carriers can be wonderful resources, and we'll talk about that a little bit more, as are crisis services, which we'll also talk about.